So I'm so glad to see so many people here today. This isn't an easy subject, but it's an important one. And we're really grateful for your time and your interest. This event is supported from, I should introduce myself first. Sorry about that. I don't have it on my notes, so I can't remember. I'm Lisa Culhane, and I administrate the Holocaust, Genocide, and Contemporary Bioethics program here at the center. And this event is presented with support from the William S. Silver's Holocaust, Genocide, and Contemporary Bioethics Program Fund. Bill is here with us today. We're thrilled to have him. And the National Jewish Health, this is also presented from the National Jewish Health through their Office of DEI and Leadership Development. The University of Denver Holocaust Awareness Institute, and Ingrid is here with us today, and the Mountain States Anti-Defamation League. So we're going to get right into the program, but first, bathroom information. There are two over on this side, or if you go out this door and down the stairs, there are bathrooms right at the base of the stairs. And the program will be recorded and sent to all RSVPs and posted on our website. And I would be remiss to not also welcome our friends on Zoom. So thank you all for being here too. And now I have the honor of introducing you to Dr. Matt Wynia, who is the director of the University of Colorado Center for Bioethics and Humanities, and a board-certified physician in internal medicine and infectious diseases, with additional training in public health and health services research. Before joining the Center for Bioethics and Humanities in 2015, he led the Institute for Ethics at the American Medical Association for 15 years and founded its Center for Patient Safety. And most recently, Dr. Wynia served on the Lancet Commission on Medicine, Nazism, and the Holocaust as an author, and was then instrumental in creating and launching the Lancet Commission Teacher Training Fellowship on Medicine, Nazism, and Holocaust.
This is a talk that I give every year. It's more or less the same. I will say this year it's a little more challenging even than usual because of the situation around the world. And of course in Gaza in particular. So we will get a chance to say a few words about that towards the end of the talk. I tend in this talk to just try to tell the story and not give too much commentary about how this story has implications for today, because I feel that most people will hear the resonances, most people will hear the echoes, they will see the implications of this history to how we think about bioethics today. This is a talk that I put together with Dr. Patricia Haber-Rice at the U.S. Holocaust Memorial Museum about 15 years ago originally. So it has evolved in that time. But I want to spend a second just giving thanks to Patricia, because she's been incredibly influential in my own thinking about how she's a senior historian for medical crimes at the Holocaust Museum in Washington, D.C. I also need to just give the disclaimer that although I'm on the Lancet Commission and I've worked a lot with the Holocaust Museum, I've also worked with a number of other organizations and still do work with a number of other organizations. This is my own synthesis. It is not an official statement of the Lancet Commission or any other organization. Patricia starts her version of this talk by saying this is a story of medicine co-opted by a notorious dictator. And there's some truth to that, that I agree, it is that story, but it is also the story of how we got to where we are today with our medical ethics and our healthcare ethics. It's also a story that can inform how we think about the future if we can figure out how to learn from this story. And it's a very difficult story to learn from, it turns out, for reasons that I'll talk about in just a moment. It is certainly true that the way we think about ethics today is shaped by this history. I defy you to think of a modern ethical dilemma in healthcare that is not in some way influenced by the legacy of medical involvement in Nazism and the Holocaust, whether it is genetic ethics, whether it is abortion, whether it is end-of-life issues, medical assistance in dying, whether it is public health ethics during the pandemic, right? Mandatory vaccinations. Everything we think about today in bioethics is in some way influenced by this history, even when we don't know it. It's implicit in the way that we think about medical ethics. This talk and telling this story is very challenging. And I just have a blank slide here for a second because I want to just speak to you directly as we get started. I give a lot of difficult talks. If it's not a difficult topic, it's probably not an ethics topic, right? If everyone agrees, then there's probably not an ethical dilemma there. So I'm used to giving challenging talks, but this one is challenging in two ways, one personal and one professional, that I want to be very clear about as we start. The personal reason is that, you all, many of you give talks, you know that there's a possibility when you are giving a talk that someone in the audience will know the subject as well as you do or better. Right? There might be someone in the room who knows more about it than you do. With this talk, there are people, including people in this room, who own this material in ways that I never will, right? Because I'm not Jewish, I'm not German, I have no direct familial connection to this history. And yet, somehow, I think we all need to take ownership of this history. It is in some important ways unfair that remembrance of this history falls disproportionately on Jewish people. This is not just Jewish history. It wasn't Jewish doctors that I'm going to be talking about today. This is our shared history as health professionals, and somehow we have to all own it. Which gets me to the second part. This is, as I mentioned, challenging professionally because it is so difficult to take lessons from this history. Some would say we shouldn't even try. And there are a couple reasons for that. Number one, I titled this talk, How Healers Became Killers. And there's a very real risk if I do a good job of explaining how Nazi doctors thought, what got them to do what they did, that it leads people to think that I am making excuses or rationalizing what Nazis did. That's a challenge to learning from this history. These people, these human beings who did this, have become caricatures of evil. And it's hard to learn from a caricature. And yet, somehow, we have to figure out how to learn from this history. So as we start, I'll just ask you to sort of open your mind, despite the fact that if I try to make any analogies, someone is bound to say that's a bad analogy. And they're right, by the way. Right? I mean, I talk about research ethics quite a lot. There is no research ethics scandal happening today or in the last 50 years that is comparable to intentionally infecting a young girl with typhus, watching her die, and then killing her twin so that you can compare their organs. Right? We're not doing anything like that. So how can we learn from that? But we have to. We have to figure out how to learn. I'll also say, in titling this, How Did Healers Become Killers? I am aware that I am focusing this talk on the perpetrators. And at this time of the International Day of Remembrance of Victims of the Holocaust, one might focus this talk entirely on victims. And I think a lot of programs do, and that is appropriate. I, however, am going to focus on how healers became killers. And for that, I kind of have to focus on the perpetrators and how they came to do what they did. And that story starts far before the Nazi era. And it doesn't end with the trial at Nuremberg. Continues till today. If you really want to understand this story, it leads to these very uncomfortable places, right? One of which is this observation by Andrew Ivy, which is, if our profession had not been as integrally involved as it was, it is possible that the idea of death factories to commit genocide might have never come about. That sounds like a pretty outrageous statement, honestly. Hitler obviously did not need doctors to be anti-Semitic. Didn't need doctors to commit many aspects of the Holocaust involving, the Holocaust by bullets. But I'm not the first person to think this, right? This is Andrew Ivy in 1946 at the Nuremberg medical trial. This story really starts at least as far back as Plato, who in 300-400 years before the Common Era was writing about how the guardians breed. So the idea of humans as having breeds, what we would later call races, the idea that a breed of human beings ought to be encouraged to reproduce. And if a defective member of the community is born, they should be set outside to die because they threaten the well-being of the community. This is an early example of what would later come to be called eugenics. The basic principles of eugenics are those of selective breeding, right? The idea of eugenics is if you can breed a bigger ox or a faster horse, you can do the same with human beings. And if you do that with all the human beings in a community, you can create a stronger community, a more vibrant, virulent, right, community that will beat out all the others, the ideas of social Darwinism. Eugenics has both these sort of positive and negative aspects to it. And I don't mean that in the moral sense. I mean, positive eugenics means encouraging reproduction amongst those deemed valuable in society. And negative eugenics is discouraging reproduction among those who are not valuable for society. And the Nazis approached both of these, obviously. They had programs to encourage healthy pregnancies and childbirth, and they had programs for disvalued members of society that led eventually to those individuals being killed because they were seen as posing a threat to the larger community. Eugenics is, my colleague Paul Wolpe calls this a very elegant theory because it explains so much around people in that era, and it really ties together various threads that are happening at the same time. So the eugenics moment in history is a confluence of the rediscovery of Mendelian genetics. So this very simplified version of human genetics, plant genetics and animal genetics, but a very simplified understanding of genetics. But that happens at the same time that novel methods of epidemiology and statistics are also being brought in. So you see this confluence, right? These streams coming together, and notions of Darwinism, survival of the fittest, both at the individual level and at the community level, right? Social Darwinism. So you add together social Darwinism, social medicine, what we now call public health, which was also in its infancy at that time. So you have public health and social Darwinism and a simplified genetics all coming together to explain why certain members of society are more likely to be truants or to have children out of wedlock, right? All of these social ills are explained using science. This is not a Nazi invention. Many of the most prominent eugenicists are British and American. Carl Pearson, who some of you will recognize, the Pearson chi-square test. He invents the idea of the p-value. So a very prominent guy, and these were incredibly well-read books. The Grammar of Science was the first book that Albert Einstein assigned as reading for his Olympia Academy. So very prominent thinkers, and you can see that, you know, this idea that feeble and degenerate stock, that nations that are that comprise feeble and degenerate stock ought to be taken over by nations that have more robust stock. This idea of struggle of race against race. And I highlighted Aryan here because this concept of there being this strong Aryan race is present in 1901 when Hitler is 12 years old. So he did not invent this way of thinking. This is the attendees at the first International Eugenics Conference that takes place in 1912 in London. And there are some people on this list who will become prominent Nazis, right? Ernst Rudin, for example. But if you recognize any of these names, it's probably not the ones who became Nazis. You might recognize William Osler or Alexander Graham Bell. Here are the notes from that conference, just one little snippet. This is a presentation by a gentleman named Alfred Punnett. Some of you, if you remember high school biology, will remember Punnett squares. So Punnett says that if we could just keep feeble-minded people from reproducing with other feeble-minded people, in a generation or two, we would have no more feeble-minded people. These conferences took place in the United States as well. There was a series of race betterment conferences in the US. This is the first one at Battle Creek, Michigan, hosted by W.K. Kellogg, of course. And again, if you see, if you recognize names here, maybe the most prominent one in terms of historical relevance is Harry Laughlin, who had written a model law for the forcible sterilization of people who were deemed irresponsible to reproduce on their own. So they would be forcibly sterilized. That law was initially passed in Indiana in 1907. I'll say more about it in just a minute. At this time, this is from 1913. I found this at a used bookstore in Michigan years ago. It's the Speakers Bureau for the American Medical Association. So in 1913, you could invite someone from the AMA to come to your church or your school or your Chautauqua and give a talk. And I'll just show you the page that shows Colorado, because I would say about a third of these talks are about race hygiene and eugenics. So this is a Dr. Corwin from Pueblo who will fill 3 appointments speaking on eugenics and how eugenics is going to save us. You all will probably know that America was a leader in the concepts of race, right? We were way ahead of the rest of the world, really, in defining who counts as being what race, and then using that in law. So before World War II, all of the states in yellow and red had laws that defined who was Black. And in many cases, as you all probably remember or recognize, one ancestor at any remove would often count as being enough to call you Black in the eyes of the law, the so-called one-drop rule. The Nazis actually, when they come to power in 1933, send a delegation to visit the American South. to look at these laws and decide whether they can learn something from these laws in terms of their own desire to define who's Jewish. Because this is not an easy thing to do when you've got a lot of people who have varied backgrounds. So who's going to count as Jewish and who's not? And they look at the American one-drop laws and say, no way, that's far too extreme. Germany would not, for Nazis, this was too much. So when the 1935 Nuremberg race laws are passed in Nazi Germany, they say you have to have 3 grandparents who are Jewish to be fully Jewish. If you only have 2 grandparents, you're just mixed. More directly relevant from a medical standpoint way in which the Nazis looked at the US were these laws around forcible sterilization. Well over half of American states had forcible sterilization laws by the time the Nazis come to power. I mentioned a minute ago that Indiana had started this with a law in 1907. That law was repealed. It was taken to court. It was implemented again a couple times. So it had been through this policy development process of knocking out the kinks of the law and making sure that it could survive scrutiny by the courts. And so Laughlin had used this experience to write a model law, which was then being implemented in a number of other states. And those laws were eventually brought to the US Supreme Court. So we see the 1927 infamous case of Buck versus Bell, where there's a famous or infamous line at the end of this decision about 3 generations of imbeciles are enough, from Justice Oliver Wendell Holmes, because Carrie's mother had been institutionalized. Carrie, in the photograph here, was living with a family whose nephew probably raped her. She became pregnant, and when that baby was born, that baby was deemed to be an imbecile as well. So Carrie's mother, Carrie, and the baby are the 3 generations of imbeciles. And Carrie was to be sterilized so that she would have no further children. I highlighted the sentence before that as well, which is not usually noticed when people quote from this decision, but I think it's critical for this audience. This is a medical public health decision, right? The entire justification is protection of the community from the threat posed by unregulated reproduction. So when the Nazis come to power in January of 1933, one of the first things that happens is Ernst Rudin, I mentioned him a minute ago, he has in his back pocket or his desk drawer a copy of this model law. It gets implemented almost immediately. So July of 1933, the Nazis pass this law for the prevention of progeny with hereditary diseases. And it looks very similar to the model law that Harry Laughlin was peddling around the United States. Very similar in terms of the forcible sterilization categories. Within these categories, by the way, by far the largest number of people sterilized have what they call hereditary feeble-mindedness. This is, of course, not a condition that you would know today. This is not a real medical condition today, but it was at the time. You may remember at the time they also had, different categories of idiocy and feeble-mindedness and, different ways of describing people with various intellectual disabilities. But this hereditary feeble-mindedness also encompasses women who get pregnant outside of wedlock, children who are disruptive in school or who are persistently truant. Right, hereditary feeble-mindedness allows you to sweep up a lot of people that you'd just rather not have reproduce. The Germans are Germanic. They are precise in this work. to some extent. And so they set up these hereditary health courts. There are about 250 of these established around the country. They run in parallel with the normal German legal system. Hitler was a dictator. He did not like the normal legal system. So this gets set up as a sort of parallel process to the normal legal system. If someone is denounced, they go in front of this hereditary health court. The court has 2 doctors and 1 attorney that make the decision. So the doctors bear the weight of decision-making authority, but if they're split, the attorney breaks the tie. And there is an appeals process of about 2 weeks, if I recall correctly. And if you lose your appeal, you have to be sterilized, I think, within 2 weeks again, or 4 weeks. But it all happens relatively quickly on relatively little real information. People are typically denounced by their doctors or nurses into this process, although there are also people who are denounced by their neighbors or even by their family members. This leads to, sort of a next obvious question, which is if you're trying really hard. By the way, the Nazis were trying really hard. Just to give you some numbers on this, over about 70 years in the US, health professionals would forcibly sterilize about 70,000 people, which is an enormous number of people. In about 5 years, the Nazis sterilized almost 300,000 people in a country a third the size of the US. So they're very aggressive at this sterilization program, and they are trying not to let any children with disabilities be born. So the next question, of course, is if a child with a disability is born, what do you do? And this is Karl Brandt, who was the chief defendant at the Nuremberg doctors' trial. This is his description. Take it with a giant grain of salt. Karl Brandt was Hitler's personal physician. He, as I said, was the lead defendant in a major trial where he was at risk and was put to death. So he lies all the time during this trial. So I don't know, how much to take from this, but I'll just tell you what he said is that there was a child born with severe disabilities that the parents essentially called up and said, would you send someone to approve the mercy killing of our child? They sent Karl Brandt. He agreed that the child should be put to death, but he said it would be cruel to make the parents think they had made that decision. The state should make that decision. Doctors should make that decision. They should not leave it to parents to make that decision. So the first mass murder program of the Nazis, preceding the Holocaust by about 2 years, is the so-called child euthanasia program. And euthanasia is in scare quotes here because this was not euthanasia as it's deliberated and debated today. These were not parents asking for their children to be killed. In fact, this was a cynical program of mass murder in which parents were deceived. So the midwives, the doctors who delivered babies had to fill out a form about a baby if it was born with a disability. Those forms would go to a central office. If the central office thought that baby should qualified for what they called special treatment, the parents would receive a letter saying, we want your child to be sent to a special treatment center. The parents would get a letter after the child arrived saying it's doing well. Then they would get another one saying it was doing poorly, that it had contracted an illness, and then that it died. In fact, of course, what was happening is the children arrived and they would either be starved to death or sometimes killed, often with an injection of phenol directly to the heart. But they would be given a death certificate that said it had pneumonia. So this is a mass murder program in which between 5,000 and 10,000 children are murdered over the course of the next 7 or 8 years. By the way, the last child killed in this program was actually killed after the end of the war. So this notion that it's the doctor's responsibility to decide whether a child's life is worth living and to kill those whose lives are not worth living had become entrenched in the medical community. These were these special killing wards were located all over Germany, but eventually in this next program, which is the natural extension, honestly, of thinking about this for children, is, well, what about adults who are living in institutional settings, who are taking more from society than they're giving? And the answer is to extend this program to the adult population. These are two of just a few of the, so there's 6 T4 sites, 6 T4 killing sites around Germany and Austria. This program also starts in 1939, and in this program, all of the asylums around the country, the directors of those asylums are asked to fill out forms on all of the people who are housed there, asking, do you think they have a chance of becoming well again? Do you think they can work? Are they Jewish? These are the types of questions, these sort of demographic questions. And in fact, there were doctors who said they thought that this was for forced labor. And so they exaggerated how ill the patients were sometimes because they wanted to save their patients from going to forced labor camps. And instead, of course, what that did is it marked these patients for death. They would then be picked up, taken to one of these 6 central killing centers, which are typically in the basement of an existing psychiatric hospital. They would arrive, they would be stripped, they would be told they were going into a shower. The shower, in fact, would be a gas chamber. They would be gassed to death. Their dental gold would be removed, and then they would be cremated in specially designed crematory ovens. And if all of that sounds familiar to you, of course it should, because the crematory technology, the gassing strategies, the camouflage techniques that allow for people to walk into a gas chamber not knowing, all of these are developed and tested in the T4 program before they show up in the Holocaust per se. By the way, these are not primarily Jewish patients. If you were Jewish and in an asylum, you were certainly killed. There was a special program for Jewish patients in these asylums that ensured all Jewish patients in asylums were killed. But the vast majority of patients killed in the T4 program are ethnic Germans, but they are seen as posing this threat to the well-being of the community. In August of 1941, Hitler himself calls a pause to the T4 program because of rising complaints and protests against this program, including from the church. So Hitler pauses the T4 program. A lot can be said about why, but in any event, he pauses the program, which leaves about 100 operatives from the T4 program out of work. These people, including this guy, Johann Neumann, who worked in the T4 program and then is transferred to create and to run the set of what are called the Reinhardt camps. These are pure killing centers. These are pure factories of death at Belzec, Sobibor, and Treblinka. So there's no straight path, right, from child euthanasia to adult euthanasia to the killing in the Holocaust, but there are themes, and there are certainly ways in which each step along that way lays the groundwork for the next step. They're connected by ideology, they're connected by technology, they're connected by strategy, and they're connected by the personnel. So the first commandant at Treblinka is Dr. Imfried Eberl, who was trained in the T4 program. So let me back up for a minute and just talk about German medicine before the war. Because given the story we've just heard, you might think that German medicine was sort of ripe for this kind of a fall. One of the great ironies of the Nuremberg doctors' trial was that, which was largely about experimentation in the camps, but also about the T4 program. The prosecutors went looking for any national or international standards that governed human subjects research at that time. And they found only 2 examples of national standards for human subjects research. Both were German. We had no standards in the US. In 1890s, a guy named Neisser, whom some of you will recognize as the namesake of Neisseria gonorrhea. Neisser had done experiments where he injected orphans and prostitutes with syphilis in order to test out different treatments. And when the public learned of this, there was outrage, and the Prussian parliament passed a set of guidelines for human subjects research. Those were expanded upon, altered in some ways, and adopted to the entire of the Weimar Republic in 1931. These called, but for example, for the existence of something that sounds very much like what we would call an IRB today. And they both require what they call the unambiguous consent of any human subject of medical research. So if anything, the Germans were ahead of the game in terms of human subjects research and medical ethics. Scientifically, Germany is also ahead of most other countries. This is the Siemens electron microscope, invented in Germany, used to detect asbestos in lung cancers, looking for the connections between asbestos and lung cancer. Just to give you a sense, if you were in this era wanting to become a world-renowned surgeon or doctor, you went to Germany for your training. This was widely recognized as the place to go. In the 10 years before the Second World War, 6 of the Nobel Prizes awarded in medicine and physiology were awarded to German speakers. So Germany was a powerhouse in terms of medical science. It was also a powerhouse in terms of the early work of epidemiology and public health. This is looking at smokers versus non-smokers and compare, I don't know how those marks got on there. Anyways, smokers and non-smokers, noticing, for example, that women are much less likely to get lung cancer. They're also much less likely to be smokers. These are ways in which the Germans took what they were learning in epidemiology and public health and applied it to public policy, right? So this is a poster that might be hung up in a bus station, encouraging women to do breast self-examination and to track their menses, looking for signs of potential cancer that might be caught early. This is a poster asking people to avoid alcohol and nicotine during pregnancy. The Nazis famously barred smoking in many public places, including the Nazi offices. You notice, by the way, the African-looking head on the cigar, which they used intentionally here because they tried to present smoking as a vice of degenerates. And I use degenerates intentionally, right? This is about genetics. This is, right, degeneracy is about a defect in the gene. This is a marriage counseling image in the years of the Nazi rule. If you wanted to get married, you had to go to a genetic counselor who would allow you to get married or not. You see on the bottom the dejected people walking away because they've been turned away on the basis of either some kind of a genetic condition or because of race mixing, which was increasingly not allowed. This is presented to people as science, but this is a pretty telling image. This is from a high school biology textbook, and it says you're sharing the load, and it talks about how much public money is spent on patients who have who require institutional level care. This was important as a political matter, right? This got the public on board with some of these types of policies. But it's also important for the medical profession because it allows or encourages medical personnel to start to see Germany as literally a body, right? Body politic, a body that could be healthy or well or ill on the basis of its racial cleanliness. This is an image that really illustrates this way of thinking. This is Adolf Hitler, doctor of the German people, right? The doctor of the Volk. And in this way of thinking, Hitler would call Jews the racial tuberculosis of the German people. Nazis called what they were doing applied biology. They were taking biology and applying it to public policy. There was a doctor at Auschwitz who was asked after the camp was liberated, how could you as a doctor have killed people like this? How can a doctor kill human beings in this way? And he said, it's the doctor's responsibility to remove a diseased organ from the patient. The Jews are the purulent appendix in the body of Europe. This description of people as pathogens is really the step that sort of leads to the medicalized aspect of the final solution. So I started with how do healers become killers? And one aspect of this is that healers in Nazi Germany become protectors of the well-being of the larger body, but not of the individuals under their care. And they do this with relatively little dissent. It's remarkable, honestly. And there are a lot of theories about why so many health professionals became members of the Nazi Party so early on. Half of doctors, roughly, maybe a little more, become members of the Nazi Party, which, by the way, means half did not. So this was not required. They chose to become members of the Nazi Party, either because of career advancement, because there were a lot of Jewish doctors in plum positions that were vacated once the Nazis came to power. There were aspirations to greatness, that medicine was going to save Germany and create a master race. So, there's undoubtedly some truth to all of those different aspects of this. I just wanted to point out, it's not just doctors. 62% of maxillofacial surgeons become Nazis. Nurses also become Nazis. I put the Zyklon B canisters up here because, of course, pharmacists were very involved in this era. Dentists, there were at least 40-something dentists were prosecuted for their role in the Holocaust. So this is across the health professions. And this medicalization, I think, can be epitomized with this next image, which I apologize, it's a disturbing image. But there was a killing pit at the camp Treblinka. This is not an image of Treblinka. There are no known images of Treblinka, or at least I don't know of any images of Treblinka as a camp. But this is a typical execution pit. Treblinka is built in a rural area. Treblinka is the death camp where the Jews of the Warsaw Ghetto are exterminated. So about 900,000 Jewish people are murdered at Treblinka. Treblinka is built in a rural area, and it's built to look like it's a town with a normal train station. The train station apparently had, posters and timetables, so it looked like you were arriving at a train station where people both came and left. So there would be, posters about holidays in Greece, that kind of thing. And there was a door with a red cross over it, which looks like an infirmary. In fact, the infirmary door takes you to a killing pit where people who are too weak to go to the gas chambers would be shot. And there are records kept of these murders. And the records say the patient was cured with one pill. So from that level of medicalization of frank murder, it's actually not so hard to envision how doctors get involved in ramp duty at Auschwitz. This is the quintessential image, I suppose, of the doctor's role in the Holocaust, is separating people at the ramp, either for immediate murder in the gas chambers or for experimentation or forced labor or some other fate. All the doctors there, save one example that I know of, participated in ramp duty. The one person, Hans Munch, famously declined to participate in ramp duty and had received no punishment. So there was not an obvious reason why people had to do this. They were okay doing it for the most part. These next two images are cartoons, but they also may be the most disturbing images I'm going to show you. You might be surprised to learn that one of the first decrees of the Nazis when they came to power was to forbid live experimentation on animals. Vivisection of animals was forbidden. So this has the lab animals of Germany saluting Hermann Göring. The poster at the end says vivisection forbidden. Given what the Nazis were doing to prisoners of war, to Jewish people in these camps, how do you square this? This is how they squared it. This says infectious germs. Here, the scientific gaze of the microscope looks down on the petri dish of society. People have become pathogens. But let me close with just a couple thoughts on remembrance. How should we remember and try to learn from this really terrible history? This is an exhibit at the Holocaust Museum in DC where memories are preserved, in this case, shoes. And the director of the museum has said the museum itself is special because it's really a museum about responsibility. So I want to close with reflections on what is our responsibility as health professionals whose ethics and social roles were so challenged and harmed by this legacy. I normally have more specific things to say, but in this time, I think what I will say is that this reverberates in many different ways, and those different ways are sometimes in conflict even with each other. Right? There's an obvious lesson from this about the risk of anti-Semitism and the horrors and the ways in which all of us are harmed when anti-Semitism is allowed to thrive and be supported. There is also a legacy here about anyone in wartime dehumanizing others in wartime, right? That when you are feeling an existential threat, which in this instance was created, right? The sense of existential threat was a Nazi invention, but it didn't stop people from acting on that. And that can happen no matter what your background is. When you're feeling threatened, you start to dehumanize the group that poses the threat to you. And, we did this in the wake of the 9/11 attacks. We used that and our fear to justify torturing prisoners, to justify, an invasion, heinous war crimes, honestly, for which we've not yet been held to account. And it is hard, I think. It's hard for Israel not to do the same, honestly, as we are seeing. And it is really hard when you continue to get attacked, right? The threat is real. It's not left. And the threat is a genocidal threat explicitly. So I don't have an answer to all of this. Honestly, I wish I did. I think we did inherit, international rules which ought to govern, and there are mechanisms for addressing breaches of international law which are being utilized. Not in every way that they ought to be. In some ways, they probably ought not to be, but they are being used. And if there's anything good to be taken from this right now, it's the potential for current experience to reinforce and solidify the international order of human rights law. I also put up here the issue of abortion / forced pregnancy. I put it up because I almost always get this as a question. And it's a really interesting area because people use the Nazis in ways that serve them in this debate, right? Because the Nazis forbid abortion for Aryan women on penalty of death. The penalty for a doctor who performed an abortion on an Aryan woman was death under Nazis. And they required abortion for women that they didn't want to have babies. So whether, wherever you stand on abortion politics today, you can call on the Nazis and say, look, that the other side is behaving like Nazis. And the problem, of course, with all of those arguments is that the Nazis' arguments had nothing to do with the arguments we're having today. They were not about the well-being of the fetus or the dignity of the fetus or whether the fetus is a human being. At what point does it become a right? All the things we talk about today, completely irrelevant to the Nazis. All they cared about was the well-being of the community that was being created. So if you were in possession of something that was valuable to the community, you had to keep it, you had to birth it, period. It didn't matter what it meant to you. So this is about control over the reproductive, community. I'll just end with this. I always end with this slide because Robert Proctor is a prominent Holocaust historian, and I think he got this right. It is easy to create caricatures of these, of the Nazi doctors. But if you do that, it becomes much harder to learn lessons and to see the path that they took, to see how things we do today may be echoes or reflections or have connections to that path. And that should be the way that we learn from this. If we can't learn, then, as he said, our ability to understand the origins of these medical crimes is forfeited, but also our ability to learn from these crimes to influence how we create the future of medicine is also forfeited. And that's an important task for us because this was not a matter of a few monsters, climbing up from the depths. This was a matter of most physicians, most nurses, most health professionals in the most advanced industrialized nation on earth becoming murderers together, and not despite their training, but in the name of medicine and science and public health. Just put up a couple of resources. The Lancet Commission report just came out. Actually, I have copies of it upstairs if anyone wants a copy of it. I meant to bring you one. Let me stop there. And I hope we have, even with cutting all those slides, I left myself 5 minutes for questions.
I just want to thank you for making it so frightening, but also so clear when we hear that the poisoning of the blood of our country and how that connects to the body politic rather than the individual and the dehumanization of entire groups. I hadn't put those two together, and I thank you.
Are we getting questions online? Ed Bill.
Matt, thank you again for doing this every year. It's painful to hear, but it's also painful to present, I'm sure, personally for you. But you also change your talk every year, and the slides that you had toward the end, including the International Court of Justice, in terms of plausible genocide accusations, etc. Speaking on this for at least the last 15 years, how much do you feel that we've moved the needle in our society in America regarding lessons of the Holocaust?
Such a good question, because you can certainly make arguments, and I know a good friend of ours, Len Rubenstein, speaks about this some, that at least in the last 50 years, there have been really significant advances in the way that wars are fought in terms of protection of civilian populations. And those, you can argue, are an outgrowth of the Second World War. There were protections for civilians before the Second World War too. I don't put everything in that bucket, but some of those protections have had very meaningful influence, right? There are tactics that we used in Vietnam that people just don't really use anymore. So you can make a sort of positive argument that things are better today. The firebombing of Dresden probably would not happen today, right? And you can also make the argument that some things that had become, unusable tactics, like starvation of entire populations to get at the militants inside that population, that has become, it's illegal, and yet we see it. And, I'm not referring only to Gaza. I think we've seen this in half a dozen other conflicts where the use of starvation has been a very explicit strategy of the warring parties against each other. So there is always going to be, especially in an existential war, but even in a non-existential war, I mean, look at the war crimes that Russia is committing in Ukraine. That's not an existential war for Russia. That was a war of choice for Russia. And yet they are, committing heinous war crimes, which are clearly contrary to international law. So I think you can always find examples of things going, retrenching, going back. And you can find examples that are positive that say, look, don't give up on it. There is value in having an international legal regime, even if it is imperfectly employed and imperfectly held to. And, I'll just, for myself, the fact that Israel went to the International Court and takes these proceedings very seriously is mounting a defense, right? Like the US wouldn't even do that, right? So I think there's a lot to be said on it, obviously. And I don't have one view on whether international law is working or is not working. It works sometimes, and it doesn't work all the time. And we should all be on the train to try to make it work more often and more consistently, even when the victors are the ones being accused of the crimes.